The signs and symptoms of malaria typically begin 8-25 days following infection. However, symptoms may occur later in those who have taken anti-malarial medications as prevention. Initial manifestations of the disease, common to all malaria species, are similar to flu-like symptoms, and can resemble other conditions such as sepsis, gastroenteritis, and viral diseases. The presentation may include headache, fever, shivering, joint pain, vomiting, hemolytic anemia, jaundice, hemoglobin in the urine, retinal damage, and convulsions. The classic symptom of malaria is paroxysm, a cyclical occurrence of sudden coldness followed by shivering and then fever and sweating, occurring every 2 days. Tertian fever, in P. vivax and P. ovale infections, and every 3 days. Quartan fever, for P. malariae. P. falciparum infection can cause recurrent fever every 36-48 hours, or a less pronounced and almost continuous fever. Severe malaria is usually caused by P. falciparum, often referred to as falciparum malaria. Symptoms of falciparum malaria arise 9-30 days after infection. Individuals with cerebral malaria frequently exhibit neurological symptoms, including abnormal posturing, nystagmus, conjugate gaze palsy, failure of the eyes to turn together in the same direction, opisthotonus, seizures, or coma. Malaria has several serious complications. Among these is the development of respiratory distress, which occurs in up to 25% of adults and 40% of children with severe P. falciparum malaria. Possible causes include respiratory compensation of metabolic acidosis, non-cardiogenic pulmonary edema, concomitant pneumonia, and severe anemia. Although rare in young children with severe malaria, acute respiratory distress syndrome occurs in 5-25% of adults and up to 29% of pregnant women. Co-infection of HIV with malaria increases mortality. Renal failure is a feature of blackwater fever, where hemoglobin from lysed red blood cells leaks into the urine. Infection with P. falciparum may result in cerebral malaria, a form of severe malaria that involves encephalopathy. It is associated with retinal whitening, which may be a useful clinical sign in distinguishing malaria from other causes of fever. Enlarged spleen, enlarged liver, or both of these, severe headache, low blood sugar, and hemoglobin in the urine with renal failure may occur. Complications may include spontaneous bleeding, coagulopathy, and shock. Malaria in pregnant women is an important cause of stillbirths, infant mortality, abortion, and low birth weight, particularly in P. falciparum infection, but also with P. vivax.